All right. Hello, everyone. Welcome. Welcome to all of you for coming to this Global Health Studies open house. We're really excited to have you here. I'm going to just take a few minutes to let everyone else join us before getting started. So I'll stop the screen share for just a moment to say hi, but we have quite a few on the call, which is really exciting. We've had a wonderful response to the request for this major and for this event today. So I'm very pleased to have everybody join us. And just to minimize background noise, I'm going to keep everyone on mute. Uh, and then what I'll do is I'll go through the presentation, and there'll be some opportunities to speak to some of the faculty in the program, as well as we'll take some questions at the end. So the chat window is open. If you have any questions, you can go ahead and type them into the chat, and I'll address them at the end of the presentation. And if there's anything that for any reason we can't address today, if you have specific questions about your plan of study, then we'd be happy to connect you with one of the advisors or one of the faculty members to go into additional detail. Okay, I'm going to just go ahead and get started with a couple of brief introductions. My name is Marianne Tobin. I'm the Assistant Dean for Professional Education at the College of Arts and Sciences, and I oversee all of the interdisciplinary programs, and Global Health Studies being the newest in our catalog of programs that we're offering through the college. And we're very excited because it's been a long time coming, and it's taken the effort of several people, many of whom are on the call today. So I want to just go and do some brief introductions to some of the faculty that have joined us, and then we'll get started. This project came about because we have two very successful minors in medical humanities and social sciences and medicine. So we're very grateful to the efforts of Dr. Catherine Newell and Dr. Justin Stoller, who are available today with us. We also have on the call Senior Associate Dean Jennifer Ferris-Hill, who is Senior Associate Dean for Academic Affairs for the college. We have Dr. Imelda Moyes from the Department of Geography and Regional Studies. She's teaching in the program as well, and we'll be able to talk about some of our research efforts. And I'm hoping, I was looking down to see if Hearns was able to join us. The program director is Louis Hearns Marcelin from Department of Anthropology. He's going to do his best to join us. He is actually on sabbatical in South Africa right now, and returning hopefully soon, but COVID being what it is, and international travel being what it is, we're not sure when he'll be able to return this summer, but he is due back. And also we have Assistant Dean Emily Long, as well as many of our advisors. So I see a lot of wonderfully familiar faces. I've enlisted Paul's help in helping us with any pre-health questions that may come up during the call. And of course, we have wonderful students, and the staff of the Office of Interdisciplinary Professional Studies are all on the call. So thank you all very much for your time. I hope I didn't miss anybody, but I'll get started with the presentation, and then we can go from there. So as I said, the new interdisciplinary major is titled Global Health Studies, and it is really from the students. For the past couple of years now, we've logged almost a dozen or so independent majors and minors all around the study of global health, or some aspect of global health. And then we've also, again, had these very popular minors in medicine, social science and medicine, and medical humanities. So those, coupled with the creation of a master's degree in global health and society, really were the genesis of why this major came to be. And you'll see it really aligns quite nicely, and of course is incredibly topical and really captures the zeitgeist of what we're all in, as we're all joining remotely due to pandemic. So if any of these speak to you, why study global health, why study it here at the University of Miami, it's because we are at the epicenter of something now, and we have been and will continue to be a sort of hub for the study of global health. the gateway to the hemisphere is a term that we throw out a lot, but really now more than ever do we see the impact of being located in Miami to study all aspects of health and wellness and well-being and medicine with a very global lens. So it's an international hub, obviously, for research and commerce, just being in Miami, but because of our health leadership, our wonderful faculty, who you get to talk with a little bit today, and our leadership at the university level, President Frank, Dr. Knoll, Dr. Marcelin. We have folks who are also jointly appointed in the Department of Public Health Sciences. So we really have a lot, the right alchemy for this major in so many ways. We're moving into being during pandemic, but what happens in the next year or 2 years or 10 years? What does post-pandemic prevention and mitigation mean like, in the fall when we're dealing with COVID-19 and flu season? So there's all of these questions, and we want to be the leader in training students, not only to answer these questions, but also think of the questions we haven't thought of yet. So the meaningful internship experiences are a component, but there's also a lot of avenues for research that we'll talk about today. Our program is a blend of a truly interdisciplinary blend: social sciences, humanities, ethics, policy, epidemiology, and we're going to touch on all of these. As you may or may not know, University of Miami is a member of the Consortium of Universities for Global Health, CUGH. We have been a member for many years, and this undergraduate major will just be added to the catalog of CUGH programs. So global health studies, we have 3 tracks. One is a BS, a pre-medical track, which I'll go into detail with these tracks in just a moment. One is a BA in humanities track, and one is a BA with a social sciences track. So basically what we did was take the existing minor in medical humanities and make that really robust into a full major, and that's the foundation for the BA with a track in humanities. Similarly, the social science and medicine track became the major with a focus in social sciences. And then we have a sort of mix of the two, coupled with the requirements for the Office of Pre-Health Advising and Mentoring, and that is what became the track for the Bachelors of Science. And as it might make sense, if whichever track the students elect to pursue, obviously satisfy that area of knowledge. So either STEM, in this case STEM for pre-med, arts and humanities, or people in society for the social sciences track. All of the tracks basically start the same way. There'll be a new course introduced to our catalog starting in the spring, tentatively titled GHS 101 Intro to Global Health Studies. It may have a sexier title later, but right now that's what we're working on, and that will be coming to the course catalog for spring, as well as the requirements of a methods course. So depending on the student's schedule or sort of where they're interested in or what they're able to take, there are a couple of options for methods courses, which they'd have to choose one of that list, as well as policy courses, and they would choose one of that list. There are some from sociology, INS. I believe there's a POL course that can also be part of the policy requirement. And the BA tracks are very similarly structured. So there's that core course of 101, the methods course, a policy course, and then what we're calling track required courses. So in the humanities track, they are the 3 required courses that are also for medical humanities minor, and the same with the BA track in social sciences. So I'm going to click off of the slideshow. Well, I'll just go to the overview of pre-med as well, and then I wanted to get into more granular detail of what the tracks look like. So there are 30 credit majors except for the BS. The BS is 24 credits, because students who pursue the BS will also have to do all of the pre-health courses, and that's plenty to make up for the 120 credit required for the bachelor's degree. So I'm going to switch over my screen share real quick to a document, and I'm actually going to add it to the chat. So once we open up the chat for everybody to sort of see and chit chat and ask questions, you'll also have access to a PDF that I've just put in the chat window. But to continue on, this is a more detailed plan of study for the 3 tracks. The first being humanities. Again, we have that global health introductory course coming spring, the same for methods course options and policy options. And then these courses are required of anyone who pursues the humanities track. They should look familiar to those that know about the medical humanities minor. Students can choose to take all 3 of them, or they really are only required to take 6 credits. So 2 from this list, and then finishing out 9 or 12 credits, whatever they're missing from the rest of the approved courses in medical humanities. I put a little star there because that just means that those are courses that can count as electives, but they're also part of the sort of required courses up here from this first group. And then we will proceed with creating on the books for spring a capstone experience course, as many of our other interdisciplinary majors have, where students can either do an independent study, a research project, a thesis, or an internship in global health. So 30 credits for that major for a total of 120, obviously for the BA. Same deal with the social sciences track, except the courses down here are a little bit different. These are the 3, again, students can take 2 or 3 from this list. It's the same grouping as the social science and medicine minor. And then filling out the rest of the track electives would be those that come from the list of approved courses for the social science and medicine minor. So you'll see that's a very robust list, and likewise finishing up with the capstone experience as well. Then we move on to the BS track. That's for those that are in pre-medical. And I throw out, it's really a pre-medical track. And it's, you know, if you're a student like me who I might be terrified of taking all the pre-health requirements, don't worry, we do have those other 2 options. But if you are already, maybe you're a bio major, or you're already in some sort of the pre-health, one of the other pre-health programs, you're doing these courses, this is probably the most appealing option. It's fewer credits for the major, only 24, and you'll see how we did that. So you still have the same introductory course, the same choice for methods, the same choice for policy. However, unlike your counterparts in the BA program, you would choose only 1 from the required humanities list and only 1 from social sciences. You may take more because you have electives, but you have to choose at least 1 from this trio and at least 1 from this trio. Then you would do all of the pre-health advising and mentoring courses and the same combined list of electives, which is humanities and social sciences, put together. So the focus is a little bit on the humanities and social sciences evenly in this one, but you can tailor your interest in the collection of electives. And the capstone experience will be the same. It'll follow with an independent study, senior research project, etc. Remember this one, the total for the major is only 24 credits, but it's still plenty to make up for the 120. And then I'm going to throw out, let me go back to my presentation real quick just to keep going, because we have a few new possibilities. There will be a 4+1. I'll talk about that in a little bit, but I wanted to take a break because that's a lot of courses, and sort of call on a couple of the faculty and to see if Dr. Marsland's been able to join us. There are so many research opportunities in global health. And regardless of what's happening now with COVID and limits on our ability to travel, this is a very globally focused program, not just in name. And as soon as we are able, we'll be providing opportunities for students to reach out beyond the university walls. So I'm going to ask if maybe Dr. Moyes or maybe Dr. Newell or Dr. Stoller would like to talk a little bit about their research, what they do, what some of the courses that the students could take, and some of the projects that are available. So I'm going to go ahead and unmute if you'd like. Imelda, if you want to say a few words and talk about the wonderful work that you're doing.
Thank you, Marianne. I see a couple of students I'm already working on this course, so that's great. So I'm a health geographer, and in regards to my research, I have research here in the US, but also in sub-Saharan Africa. So in the US, I focus on the Southeast, so Miami, Louisiana, and then Illinois. And when we think about global health or international work, I have a project in Honduras, and then I have a project in Nigeria. I'm just starting this summer. having finished one there where we're looking at kind of digitizing and helping the Federal Ministry of Health to convert immunization maps from paper maps to digital maps. And I worked a lot actually with students in my class, my prior GIS class here, to help with that work. And then I also have a couple of projects in Zambia and in Burundi. In regards to students on my project, Charlotte, you're here, you want to talk about what I look for? So usually I like students I work with students from all backgrounds or all majors. Really, you have to have at least a good understanding and passion for data, as well as to work with different data formats and data types to bringing that data together and then making sense of that data to answer a research question. Also, one of my students, Lola, who is not here, she's working with me this summer. She actually got a scholarship from the college. So the college also has resources for that, where you can apply for a summer stipend to work with the faculty on a research topic of interest to you, but also to the faculty mentor. In regards to the classes that I teach, I saw some of those classes there. I teach an immigrant and refugee health course. I'm studying a new course this summer on pandemics, plagues, and people. I also teach GIS for health, which is more about data and mapping and spatial thinking. And I teach a class on food. And then I also teach a research methods course. Does that make sense? Is that what you're asking for, Marianne?
Yeah, that's perfect. I bet your class on GIS for health, I don't know if anybody else has been doing, I'm sure what I've been doing, checking Department of Health websites every day, and it's always ArcGIS that pops up that shows all the data of where, how many people in your zip code have been affected by COVID. Is that those kinds of projects that students would be working on, or if they come into your class with GIS, so they get to use ArcGIS software, right?
Absolutely. I have on this course, so I see Charlotte. Charlotte took my, hey Charlotte, she took my GIS course last semester, and we have continued this summer working on a COVID-19 project, but also working on a rat project in New Orleans. Charlotte, you want to talk a little bit about your experiences on that?
Sure. Yeah, I took Dr. Moyes' GIS for Health and Environment class last semester, and it was really awesome. Dr. Moyes is an amazing professor, and she just made me want to research this so much further. But for my final project, I worked on rodent populations in New Orleans and looking at the ecology and their movement and socioeconomic factors that we might see trends with rat movement. So basically this summer we're just continuing working on that right now. I was just pulling literature all morning for that project.
Oh, good. You get an A for today.
Thank you.
Well, I have no control. I have no say. But you get gold star. I can do gold stars.
Thank you.
Stars. You're welcome. Well, that's wonderful. I know we have Dr. Stoller and Dr. Newell on the call too, if they want to chime in and talk a little bit about what their work. And I know Dr. Newell from the Humanities, from the Department of Religious Studies. She's got a new book out. She's having a fun summer.
Working on a book, getting close. Thank you for that, Marianne. And I also see some names that I recognize, so it's good to see everybody while not seeing everybody. So as we just heard, I am the advisor for the Medical Humanities minor, which is now one of the tracks in this major. I personally teach in religious studies, so I teach the religion and medicine course. I also teach a course on religion and bioethics, and I have a lot of students who gravitate towards, I teach other classes as well, but students who gravitate towards the medical humanities tend to be obviously a lot of pre-med, pre-health people anticipating going into the medical fields in some capacity. And one conversation that I have over and over again with students is just the idea of the phrase that comes up a lot in applications for medical school, nursing school, et cetera, are the ideas of cultural competencies and being able to know about and speak to things like how people's religion affects the choices they make about their healthcare, how religion is embedded in a lot of cultures, the intersections between, say, religion and science in classics. You know, we have some folks here from classics talking about the ancient roots of medicine and how closely aligned medicine and religion were and still are today. So there's a lot of very productive things that come out of medical humanities that I think students are a lot of times startled by how much what they learn in, say, a class on religion and medicine has to do with how they then think about their future careers, about global health, about dealing with pandemics and all of these different things. So as far as research and further study goes, I have had students I've worked with on papers that we've then either submitted to, say, journals or that have become capstone projects that they then built on in graduate work that are more research oriented. In the humanities, we tend to read books and look at things historically and across time periods. So I love when I get the science-oriented students who just love using the other part of their brain to really dig into a research question and see the historical orientation and roots of some of the things that we are dealing with today. Say again, what did people do in earlier pandemics when they had to quarantine? What did, say, the Catholic Church do during the Black Death? So these are things that seem extra relevant today, and those are the sorts of journeys that I love to see students head out on and try to shepherd them as best I can. So please feel free to ask me any questions about my classes or any of the other classes in medical humanities. And yeah.
Thank you so much, Dr. Newell. Dr. Stoller, I see Dr. Ferris Hill from a couple of our other departments. I love your background, Dr. Stoller.
Thanks. These days, I'm often not sure what world I'm living in, so I thought
That's
this was
fair enough. Fair enough. Red pill, blue
appropriate,
pill, could be anything. We don't know.
Yeah, it's great to see so many of you in this webinar, whatever we're calling this, and I'm happy to introduce myself. I'm Justin Stoller. I'm based in the geography department, but dually trained in infectious disease epidemiology and geography, and so it's been a very busy couple of months catching up on any contributions I've been able to make to COVID projects, and there have been a bunch. In my career, I've always been drawn to health disparities at that global scale, those global health problems that transcend boundaries and affect everyone, and that involve issues of equity and so forth. And much of my research time now is dedicated to water and sanitation projects that originated in West Africa, where I've been working for over a decade, but now have involved about 30 different countries all around the world, looking at different water problems. And it has been an interesting linkage to the coronavirus outbreak, and that all the lack of adequate water and sanitation around the world has been a huge driver that's causing ongoing COVID problems around the world. So I've been really engaged with that and on an international scale with a large network of researchers that work together in a team science type of environment. And then here in Miami, I'm involved with other members of our Gables campus and the Miller School of Medicine on projects ranging from breast cancer disparities, eye diseases, gun injuries, seatbelt wearing practices, especially things that affect children and people that are especially vulnerable. I can't say no to those projects. I try to contribute any way that I can. Here on campus, I teach courses. I teach the core course on medical geography, which is something I've always had to explain. And I guess there's a tiny silver lining from this pandemic that now everybody's looking at dashboards of how COVID-19 is spreading throughout the world. And everybody's looking at medical geography every day. So there's less of that explaining that I have to do. We're also seeing a lot of medical anthropology and medical sociology and how different cultures and societies are reacting to protecting themselves from the virus and the extent that they're willing to lock themselves down and just kind of wait it out and so forth. So there's just been such a flurry of interesting research going on there. Besides teaching the core medical geography course, I also teach courses on drinking water. That's a deep dive into all kinds of interdisciplinary issues around water problems around the world. I teach a climate change and public health course and other courses about population and environment dynamics. Marianne?
Awesome. Thank you. Thank you so much, Dr. Stoller, for sharing. And just so we're with even representation between social sciences and the humanities, I'm going to ask Dean Ferris-Hill to chime in, say a few words about classics and ways to interact with classics and the medical humanities.
Hello, everyone. Thank you for being here today. I have to say it's tremendously exciting to see this major finally exist and be official in every sense of the word. It's been a pretty long road. Dr. Newell and Dr. Stoller came to me almost 2 years ago in August to suggest the idea. And it just seemed like such an obvious student interest and student need. And little could we have known at that time that the major would be launched in the middle of this global pandemic, which makes it more relevant than ever. So I just wanted to say how tremendously exciting it is to finally see this have come to fruition through the very, very hard work of all the people who participated on the development committee, especially Dr. Tobin and Dr. Moise and Dr. Newell, Dr. Stoller, Dr. Page, Dr. Morslin, and a number of other people who are not on the call today. As I think about my own field, although it's not the area that I myself work in, there's been a recent interest in medical humanities, but specifically in classics and in ancient Greece as the origin of or kind of originating place of the Western medical tradition. So classics has this interesting relationship with medicine because of Hippocrates and Galen and these writers that we trace a lot of thinking back to. The courses that we've developed in my department over the past few years really speak to the growing interest in this area. So in addition to the ancient medicine course, which is so central to the medical humanities minor, and now to the humanities track of the BA in global health, we also have ancient sciences, and we have a course on medical terminology that grew out of a course that I taught for many years on the Greek and Latin roots of English. So as I think about my own little corner of academia, it's really exciting to see classics participating as well in this global health major. So a huge thank you to everyone for their hard work. And to the students on the call, don't hesitate to reach out to me or to any of the faculty if you want to talk more about studying global health. Thank you.
Thank you all very much. So I'll get back to the presentation and kind of shift gears a little bit. I know when you're thinking about declaring a major, pursuing a major, adding a major, it's really about the coursework and what it's going to be required of me to finish. But then what happens beyond finishing? It's a pandemic now has created economic issues or issues that were there really to begin with. But regardless, anybody graduating now or in the subsequent years, we're going to be faced with an economic crisis, the likes of which we haven't seen in a very long time, if ever. And the job market being, just top news, I would say, aside from everything else domestically that's going on. So we want you to know that this is a degree program that is not only steeped in the types of phenomenal research opportunities that our faculty just shared, but also that we have a view towards employment and your job, what happens after you leave the university. So this is some examples of internship opportunities that students who have come through the College of Arts and Sciences and specifically gone into graduate programs that are in our sort of sphere of health and public administration and public policy. We have a master's in international administration. In fact, the young man in the picture is Andrew Fisher. He's an alum of our master's in international administration and master's of public health dual degree. He, for his internship, was working with the World Health Organization and subsequently hired at the Centers for Disease Control and Prevention. Now he works as a director for Florida Cancer Specialists. So there are opportunities abound in internships, and these are some of the places that our students have interned in the past, and internship opportunities that will be available to students in this major, as well as students that might consider going on to graduate study. And I bring that up because starting in the spring, so the disclaimer is that this is still a sort of pathway that is being approved because it involves a graduate program. It needs an additional layer of approval at the university level, but by spring, this will be a plan code that if you're interested in pursuing a master's degree, you'll be able to enter, and it is a 4+1 into the MA in Global Health and Society. There's no GRE required for the master's degree. That is something that is unique not only to this term, so the college has been able to waive any GREs for the fall due to COVID-19, but this degree in particular, the MA in Global Health and Society, does not require GRE. So if you are interested in it, don't let the test be a barrier. The regular MA, the standalone degree program, is 36 credits. But if a student decided that they wanted to pursue the 4+1 option, the MA is reduced to only 30 credits, and that allows you to complete it in 1 year. So you would finish your bachelor's degree, graduate May, congratulations, happy, happy. The following week, you would go into the master's portion, and you may take classes in the summer. So all of the classes, well, the MA does have classes throughout the summer. Or if you need to take a break, you can count up to 12 credits that you may take as an undergraduate. So if you have extra room in your schedule, you know, maybe you brought in a fistful of AP credits and you have your senior year with some room, you can also add up to 12 credits towards the master's in while you're still an undergraduate. We are asking applicants for this portion of the program and really for the master's to have a minimum undergraduate GPA of 3.0. And classes in the master's program are available obviously within the college, but also through the Department of Public Health Sciences at the medical school and through the School of Nursing. We do have, she's on the call, but and she can take questions at the end, but Kathy Shaw is our graduate recruiter. So if you are at all interested, maybe you're an upperclassman and you've taken a lot of these classes already and you are already where you are thinking about a master's program, Kathy is the contact for that. So here's a sample plan of study, as I mentioned. You know, May graduation, you know, pandemic pending, of course. You graduate in May, and you can immediately start classes towards the master's. So you might take 2, summer A, summer B, or 2 and summer B, and then you would take a course load in the fall, and in the spring, you would do your capstone. This is pretty heavy, so obviously, typically for a graduate student, it's 3 courses in fall, 3 courses in spring. So as I mentioned, if you're in the accelerated program, you'll have the opportunity to take some of these classes the year previously, the prior year, if you are, have room in your schedule as an undergrad. And the last thing I wanted to mention before we kind of open up for questions is this is a special topics course that does not come around often, but it is going to be offered this fall. It's an introduction to global health. It does count towards these majors as one of the electives, and you can see there are any variety of course numbers that you can take it under, departments, you know, anthropology, Latin American studies, POL, all listed here. There could even be a few that I missed, but it is taught by Dr. Michael Touchton from Political Science, President Julio Frank, and Dr. Felicia Nall. This was a very popular course when it was offered a year ago, and now they're bringing it back, and what a time to be taking a class as an introduction to global health with a specific focus on our hemispheric responses to this pandemic and the pandemics before. You may take it for 2 or 3 credits. That is really dependent on your plan of study and your time-wise. The times are a little bit different. It's Tuesdays and Thursdays, but you'll notice that the Thursday class is slightly shorter. Again, there are options available for 2 and 3 credits. So I'm going to stop the screen share, open the floor to questions, but I do want to direct you quickly to the website, our wonderful website in Global Health, which covers not only the undergraduate program, but also the graduate program. So if you do go to globalhealth.miami.edu, you'll see that we have all of the tracks listed here, as well as the undergraduate minors. in medical humanities and social science and medicine. And we've even listed classes in these programs that count for the variety of cognates that are out there that touch on global health. You can read about the program. You can read about the graduate program just to kind of get a flavor for that. And again, whichever track you're interested in, if you click on it, the PDF I sent you has all of these courses, but you also will be able to find them listed on our website. At the end of this call, this has been recorded, so we'll convert this video and we'll post this video as well as the PowerPoint and the PDF of all the classes to the website, so you can go there for additional resources. And of course, there's a contact us button that allows you to speak to Kathy if you're interested in the master's program. You can contact me and I can get you in touch with any of the faculty or advisors who can help you decipher. As we know, many students who will start the major will be either adding it on as a second major or transitioning from one to the other. So there'll be a lot of real specific questions, I'm sure, about how that works. So I'll open it up to questions now, and we have several advisors on the call. So if someone can chime in to address any questions that you all may have. No questions? I couldn't have done that good of a job. Somebody must have a question about the program. Thank you all, by the way, for participating. You guys have been great. Good question. So yes, you can start the program now. You may add this major in the fall, beginning in the fall. The only program that has to wait till spring is the 4+1. So basically, if you are interested in the 4+1 program, you would just, you have to finish the bachelor's anyway. So you would pick your track for global health studies, one of the BAs or the BS track. And then when it gets approved, we can move you into the 4+1 track. So a question from Amanda. She's an incoming junior looking to transfer. Will she be able to take these classes this upcoming semester and then take the intro course in the spring? Yes, very good question. That is definitely the plan. Obviously, because of the timing of the release of the major, we weren't able to launch the 101 course in the fall, but it will be available in the spring. So yes, all of these other courses do not have that as a prerequisite. So you would take the 101 course in the spring. And subsequently, we'll be able to offer that course regularly. So it's a little cart before horse, but don't worry, you'll have a really great time in the 101 course, and also all of the culminating courses, the capstone courses, will be on the books for spring as well. Okay, so I'm looking through a couple other questions. A question from Gabriella. She's a microbiology major. Can she also do global health? And does she have to do the cognates, or is that waived? So Paul, I don't know if you can chime in. Yeah, so Gabriella is microbio, and if she picks up global health, what are the cognate requirements?
Hello. So microbiology and immunology as major, of course, satisfies the STEM area of knowledge. And with global health studies, Marianne, this is satisfying people in society?
Depends on the track. So if you choose the if you choose the humanities track, it starts in humanities, people in society, and STEM for the BS track.
Okay, excellent. So in that case, it was Gabriella, was it? In that case, Gabriella, depending on the track that you would choose to pursue with this additional major in global health studies, then that would accordingly satisfy the other areas of knowledge. So either people in society or arts and humanities, depending on the one you chose. And of course, as you may know, whichever one is left over beyond the micro covering STEM and the track within global health studies you choose, that third one that would remain unsatisfied would have to be satisfied with something of your choosing, which of course is fully up to you with our beautiful cognate system.
Good question.
Thank you so much.
You're welcome.
My pleasure.
Jason had a question. Is it acceptable to not take classes this fall? Many of you have already chosen, of course, and begin the path in the spring. So yes, obviously depending on your status, what year you're in, and how much time you have remaining. But yes, you can absolutely declare this in spring since you've already selected fall courses. And I'm hopefully I'm correct in saying that. And of course, if you like to change courses and you see courses that are available, you know, that's an option too. But yes, this can absolutely sort of wait till spring. And it will be, as this is the first public reveal, so as it gets closer to spring, all of these classes, as I mentioned, the 101 and everything else, all of those pieces will be in place and will be ready to go fully for spring. But yes, you can wait. That's absolutely fine. Melody asked the question. She's already doing a dual degree in public health. Is there a possibility to add global health? That's a question. I don't want to chime in and say the wrong thing. So your dual degree in public health, can you please clarify, Melody? Is that with the Bachelor's of Public Health and Nursing at the nursing school?
Yes. Dual degree with microbiome and public health.
Oh, okay. Perfect. Yes, I'm advisors, please correct me if I'm wrong, but yes, you can add global health. If, for example, you may want to consider adding the humanities track that would cover your cognates. Is that correct, Paul?
Indeed, indeed.
And you can also, I mean, obviously this is about the major. There's no minor in global health studies. The minors are medical humanities and social science and medicine. Those remain. They're not going anywhere. So, you know, depending on how much room you have in your schedule, you could pick up either of those minors. And then if it grew into a major, you know, that all kind of, you would declare the major instead, and the courses would count towards the major. Yeah, Gisette pointed out that yes, you might go over 120 with 3 majors, but we will encourage you to do to pursue it. I think probably the best, because you already have a double major, is to sit down with one of us and just kind of look through your plan of study and make sure that you know, you've got all the everything's ticking the right boxes.
Thank you.
And one more quick note for Melody. If you are indeed pursuing dual degrees and you went through that process to get that approved, a separate degree from the School of Nursing Health Studies that you'll be earning, as well as a degree from the College of Arts and Sciences, you already know that 150 total credits are required. So that being said, if that's what you're pursuing, then of course, you know, then it's built into what you're already pursuing to have more credits than the typical 120. So this could serve you well if this is what you wish to do.
Wonderful.
Okay, thank you so much.
You're welcome. Any other questions? I'm kind of checking the chat window to see. I don't think I missed anybody. But as I mentioned, we're going to be around. So do check our website, which is globalhealth.miami.edu. I'll pull that up again one more time just to share it with you all. We encourage you to comb over the various opportunities under the undergraduate tab. As I mentioned, everything is ready to go for fall. The only thing that will be launching officially spring will be the 100 level course, so a 101 course, and the 4+1 option. But again, don't feel that you need to wait till spring. If you're interested in the 4+1, you have to go into one of the tracks anyway, so you can start your work towards that, and then we would just add the graduate stack when it was time. Yes, I'll stick around for a few minutes if you have additional questions, but this recording and the subsequent materials will be posted on the Global Health website. We're very excited. We're very grateful for your time. I wish you a wonderful summer, a safe summer. Wear your mask, wash your hands, and be well out there, everyone. Thanks so much for joining us. Yes, you know, Amanda, I saw your question, and yes, we can absolutely put you in touch with an advisor. Since I have your email, I'll send you an email address, an email right after this, and give you the contact for one of our advisors.
Thank you so much. I really appreciate it.
You're very welcome.
All right, have a
You too. Have a good one.
If I send you my email, could you also put me in touch with an advisor?
Absolutely. My email is super easy. It's MET. It's my initials. So M for Marianne, E for Elizabeth, T for Tobin @miami.edu.
Okay, perfect. Thank you.
You're welcome. You're very welcome.
Thank you so much.
My
Bye.
pleasure. Thank you. Thank you all. Have a great afternoon. Have a good weekend.
You too.
Bye.